Good morning. I am Dr. Sridhar Kasturi, Senior Consultant Cardiologist and Head of the Department of Cardiology. Presently working at Sunshine Hospital, HYDERABAD Paradise. Today we will be discussing about the physiotherapy role in day-to-day practice, particularly in chronically ill patients. So, patients who suffer from paralysis or patients who suffer from an accident or patients who underwent surgery. Usually they require physiotherapy. So those who are suffering from paralysis, though they take treatment in hospitals, they have to continue physiotherapy at their home. So what happens when they continue physiotherapy? They need somebody's services. So otherwise they have to go to hospital regularly and they have to undergo regular checkups and they have to undergo physiotherapy, where they have to stand in queue. And you may not have the time, you may not have appointment also, that time you have to wait a lot. So instead of that, they have started bookmyphysio.com. In that one, if you call them, immediately they will come and they will provide physiotherapy at your home only. So what happens, these particularly paralysis patients, when they suffer from paralysis, they do all physiotherapy of leg and even leg muscles, hand muscles, and at the same time how to walk, and they support you. At the same time, breathing exercise they will advise for persons who are suffering from chronic pulmonary disease, chronic obstructive pulmonary disease, or those who are suffering from asthma. These patients, they require usually regular physiotherapy. So by doing physiotherapy, overall health will improve, and at the same time resistance power of the lungs also improves. And this physiotherapy is not very costly, and at the same time it's like a natural system. What we are doing in physiotherapy, we are activating muscles. Like suppose if the patient is having a leg paralysis, so they will be activating flexors, extensors, adductors. By that one, they are strengthening the muscle so that they can come back to regular day-to-day life as early as possible. So this is the concept of physiotherapy. Suppose if the patient is very thin built and like a old age patient, they are unable to produce a cough. So when they are unable to produce a cough because of the lack of respiratory muscle strength, what they do, they will ask them to do deep breathing exercise. They do the chest percussions. They will ask them to by steam inhalations. What they do, the sputum will be produced and sputum will be expectorated very effectively. So by maintaining deep breathing exercises, so the pneumonia will recover very fast, or any bronchitis is there, it recovers very fast, and the breathing capacity of the lungs will improve significantly. So by that way, the frequent respiratory infections incidence will come down, and at the same time resistance power of the lungs will also improve, and their exercise capacity will also improve. So that's the reason if you have any physiotherapy problem and where to go there, where to go for physiotherapy and whom to call, these are all the issues what you are going to face when you want a physiotherapy. So a one portal solution, and if you want to take any help of the physiotherapy, immediately you can contact them and they will come to you and they provide services at your door. Thank you, one and all, and definitely this is a very useful service, and this is for many people it's definitely very useful, particularly advanced age persons where they don't have attendance to go to the hospital, or where they don't have a transportation facility, or patient cannot be shifted without ambulance due to bedridden status. In such cases, door delivery definitely always helpful, and it will be very useful to them in supporting their day-to-day life. Thank you.